Hello, friends. Hello, change makers. Welcome to HR5, Getting Started with a Reduction Project. My name is Ali Sekbadei, and I am a Community Resource Specialist at the Canadian Alliance to End Homelessness, CAEH, and today I am quite privileged to be moderating this very important conversation, so you're in the right room. Welcome, welcome. It seems light, but yeah, there's so many different imaginary folks here today, and it's a great learning opportunity to also have a small group to interact more closely with. That is amazing. Thank you so much. I would like to begin by acknowledging that the 2025 National Conference on Ending Homelessness is taking place on unceded Indigenous lands. The Ghanaian Gakaha Nation is recognized as the custodians of the lands and waters on which we gathered today. Montreal is historically known as a gathering place for many First Nations. Today, it is home to a diverse population of Indigenous and other peoples. We respect the continued connections with the past, present, and future in our ongoing relationships with Indigenous and other peoples from coast to coast to coast. And I'm indeed very honored to be welcomed here today as a guest. So, once again, you're in HR5, Getting Started with a Reduction Project. This session is meant to equip communities with quality improvement approaches to identify and lead reduction projects. You will learn more about how to use your data to reach reductions and opportunities funded through CAEH, Homelessness Reduction Innovation Fund, what we call HRIF for short, to lead interventions and to mobilize learnings across the country. To wrap up this session, we will have an interactive segment where you will be able to engage with the CAEH staff here, our speakers here, to explore project ideas and ask questions and learn more about potential support. So what we're doing here today, we have two major presentations using data to identify improvement projects and designing strong projects that reduce homelessness. And we'll have a discussion part, a Q&A, and then the opportunity to ask questions one-on-one with an expert. So once again, I am privileged to moderate this session. My name is Alice Egbedeyi, and I am a Community Resource Specialist with the Canadian Alliance to End Homelessness. And here we have two speakers with us today. We have Kat Riley. She's the Director, Build for Zero Canada Reduce. And we have Lisa Bell, the Strategy Lead here at the Canadian Alliance to End Homelessness. Before I pass on to the juice of today, I wanted to go through just a quick summary of what we do at CAEH. Many of you might have come across, of course, you have definitely come across what we do at CAEH, because here today is one of that. So CAEH works to prevent and end homelessness by helping to build effective community response systems and campaigning for the policy changes needed for everyone to have a place to call home. And we do this through several different strategies, one of which is advocacy, campaigns, and policy. If you're signed on to our newsletters, you might have gotten one or more of these policy tools that we share every now and then in our newsletters. We work with communities and the government to develop effective policies that actually work, and while also moving public opinion. Also, we do that through community impact. For some of you who have interacted with our Build for Zero movement and team, we partner with and support communities to build local homelessness response systems aimed at reducing and ending homelessness. We also work through data and strategy, creating dashboards, insights, tracking trends, and creating resources that we can share with communities working together. And finally, we also create space to engage and learn, which is what we're doing here today. Today, the National Conference on Ending Homelessness brings together over 2,000 people annually from across the sector to learn, to share, and to connect. So CAEH continues to evolve and to innovate and pivot to really address the evolving needs that we have in housing and homelessness right now. So without further ado, I'd like to welcome our first speaker, Lisabel. Thank you.
Alice is taller than I am, so give me a second here. All right, thank you so much for joining our session today. So we're going to be talking about what is a reduction project, especially in relation to HRIF, and I'll be talking about what HRIF is. Some people say HRIF, and I will spell out what that acronym stands for, but there is no T at the end, but you can say HRIF if you really like. So essentially, reduction projects are improvement projects. So we like to use a quote often throughout CAEH from Robert Dennings, and that was, "Every system is perfectly designed to achieve the results that it gets." And so improvement projects or reduction projects are really about tackling systemic problems because we know that homelessness is a result of systemic issues in communities. And we also know that homelessness is a very complex problem, or else we wouldn't be gathering here today with 2,300 folks trying to come together and figure out how do we reduce and end homelessness, because it's very complex. It's actually more complex than building a rocket ship, because you can build a rocket ship and then replicate that and take those learnings, but we're dealing with homelessness, which means we're supporting people. And people's lives are very complex. We have complex identities, and systems of care, don't always operate well with one another. So what we're trying to get at through reduction projects is trying to improve local systems of care. Because at the end of the day, we have the power to change systems, because systems are ultimately made up of people. And so we are trying through reduction projects or improvement projects to make small changes over time, take those learnings and improve local systems so that we can untangle the complex problem of homelessness. And so, again, improvement science is about making change. So improvement projects or reduction projects are about change. Not every change that you make in a project, in an HRIF project, for example, will be an improvement, will get you to reductions, but it will teach you something. It requires us to do something different. So HRIF is not about an extension of existing programs. It's about changing something in the way that we do locally to see, does this result in improvement? If not, what can I learn from that? And the model for improvement, which is what HRIF is really based around, has 5 fundamental principles. So first is knowing why you need to improve. So making sure that you have a clear project goal. So if you have a goal in mind of, I think we can reduce homelessness by doing X, being really intentional about what your hypothesis or theory is in your community of what do we need to do that we think will help result in reductions. And then the second is having a way to get feedback on that. If I tried X, if I tried to do something different, if I made a change, is that working? How am I going to use my local data to understand if what the changes that I'm making are actually leading to improvement? The third principle of the model for improvement is developing a change, which is essentially like a science experiment in a way, like how can I do something different and evaluate what I'm doing differently. So this can be as small as changing some fields on a diversion form, to bigger projects that are about adding a particular new staff person that might change the way that you're interacting with clients. So whatever it is, it has to be something different or new to your system, and that's why the I in HRIF stands for innovation. It does not have to be a groundbreaking new thing that nobody has ever tried in the work of ending homelessness, but it should be new for your local system. It should be new for your community. The fourth principle is testing a change before any attempts to implement it, so trying to minimize risk as much as possible. and testing something out and learning about it before you go full force into, you know what, I think we need a fulsome diversion program. I've heard a presentation yesterday at the conference about this really great diversion program. That's what we need in our community. I'm going to go ahead with it. Before going through all that work, you don't actually know if diversion is going to lead to more prevention the way that it was done through that other community. So it's about testing it out in your local context. And then, I've been saying HRIF a lot, or HRIF. And so HRIF is a new initiative of the Canadian Alliance, which I'm very excited about. So it is about granting one-time funds for innovative, data-driven projects. So projects must be measurable, meaning we can see if they're reducing homelessness. And it's not for particular ongoing programs. It is a one-time grant. We have been collaborating with NIHC, the National Indigenous Homelessness Council, which we've probably seen around this conference quite often, on HRIF. And so NIHC provides support to Indigenous-led organizations as well as designated community organizations in their partnerships with Indigenous-led orgs. To be eligible for this fund, you must be a Reaching Home community entity, either for the designated stream, the Indigenous homelessness stream, the territorial stream, or an organization that is participating in the Built for Zero Canada initiative. However, if you are not one of those organizations, you can partner with those organizations to apply for an HRIF project. So you'd have to partner with your local community entity, or whether that be the Indigenous stream or designated community stream, in order to be eligible for HRIF. Projects are expected to last up to 12 months because, again, they're supposed to be one-time projects in communities and try to find sustainable funding for changes after you've introduced them. They can target any activity that's eligible under your usual Reaching Home directives, which does not typically include capital expenses, but we may consider smaller capital expenses on a case-by-case basis. So far, we have run 2 rounds of calls for applications for HRIF. We're just in the middle of deciding on folks in the second round, but our next funding round will open in February. So we will put out an expression of interest on the HRIF website, which is accessible through the Canadian Alliance to End Homelessness website on February 2nd. In addition to being an eligible organization, communities must also be able to demonstrate that improvement project that I was talking about earlier. So what change are you going to test or do differently in your community aimed at reducing homelessness for a specific population? And communities must also have quality by name data confirmed through CAEH. So the designated community or the IHCE in your area should have QB&D or quality by name data confirmed. And CAEH is really keen to share the learnings through these projects, and actually there's a session right after this one where we'll be hearing from some round 1 projects about their initial learnings. And I will pass it off to Kat.
All right, so quick show of hands. Oh, I'm taller than Lisa and Alice. Who's familiar with the concept of quality by name data? I know this has been around for a while, so probably not new. Okay, so I'm going to give you the 60-second elevator pitch crash course, just for the folks in the room who are not familiar. So by name data is real-time data of all people who are experiencing homelessness in your community. But when we say that, there are a few qualifiers. The first being that we're referring to the folks that we know about. So we understand that our role as the system leaders is to make sure that we have pathways for everyone to access the system in equitable ways and that we're doing our best to make sure that our coverage is comprehensive and complete. However, we know that sometimes we just won't know everyone. So it's everyone that we can reasonably know and who has provided consent to be part of that data set. And the second qualifier is that it's dynamic rather than static. So when we say real time, we are talking about the realest time that is feasible within the community. So for a community that's using an HMIS, such as HIFIS, real time is going to be quite more real time, so likely daily or more often. Whereas folks that are earlier in their journey to by name data might have processes that require updating your data a little bit less regularly, so maybe weekly or monthly. So to be considered real time, the minimum requirement is monthly updates. By name data is used at two levels. The first is person level data. And person level data is individual identifying information about people who are experiencing homelessness that is used to help them exit homelessness. So this might be things like their name, their housing needs and preferences, their geographic location that they need to live in, their support needs. And so this is information that we need to know about people as individuals because there is no one-size-fits-all approach to housing resources. So person-level data is what we're using when we talk about coordinated access, case conferencing, matching and referral, and prioritization. System-level data is what we're talking about today. System-level data is used to monitor system performance. So we do that by looking at who's actively homeless in the community, what is our inflow and outflow telling us. We're going to get into a little bit more of that today. And we use system-level data to help identify areas for improvement and tell us where to look. So when we have system-level data, we are not just taking shots in the dark trying to figure out what will work to reduce homelessness. We're letting the system tell us what the need is. So these are the key by name data points and a very high-level description of what they will tell you about your system. So right in the middle, we have actively homeless, and active homeless counts tell us exactly as it sounds, who is currently experiencing homelessness, how many people are there. This is a big shift for a lot of communities because historically we've only been able to rely on things like point-in-time counts that happen every 1 or 2 years. So active homelessness is something that we're looking at least monthly to understand what actually is the demand for housing resources in the community. Inflow tells us what is happening upstream in the system. How are people entering the system? We use inflow data to target prevention efforts. So if we were to look at who's newly identified to the system, that helps us answer who is becoming homeless and why. So we can understand what are the pathways by which people are entering into homelessness. Are they local? Are they coming from elsewhere? Are there certain sectors or providers that are seeing higher rates of inflow? We can then look at housing programs and how they're working by looking at return from housing. So often in homelessness, we talk about increasing move-ins, which is, of course, a very critical part of the work that we are doing. But we also need to look at, are those move-ins sustainable? Are people maintaining that housing? So looking at return from housing tells us, are the programs that we have in place working as they're intended to? On the other side of the system, we have outflow. So outflow allows us to monitor how well the system is performing. So are people getting housed? We're not just collecting folks' information to keep them in a database and wait, right? We need to make sure that those exits to permanent housing are happening. And if they are already happening, it might not be a conversation of increasing move-ins, it might be a conversation about accelerating move-ins. So trying to eliminate steps in that process and help people get housed faster. So, where can I find my community's quality data? If you are working in a community that is either a Built for Zero Canada participating community or a Reaching Home community entity, it is likely that there is quality data in your system or that your community is on the way to quality data. If you are not sure, in designated Reaching Home communities, CEs are required to maintain quality by name data on all people experiencing homelessness. So your first bet there would be to reach out to your local CE. And we've linked here where you can find on the Reaching Home website who those organizations are locally. At CAEH, we also confirm communities for having quality by name data. So that includes Reaching Home communities, and it also includes communities that we work with through the Built for Zero Canada program who might not be part of Reaching Home. So again, you can look on our website and sort by province to see if your community is participating. Community entities and Built for Zero communities that don't yet have quality data can still get there. So if you are listening to this presentation wondering, we're not there yet, is this fund for us? It can be, just maybe not yet. There are 5 rounds of HRIF, and we're just wrapping up applications for round 2, as Lisa stated, so there is still time. And part of what we do at Built for Zero is support communities to achieve and maintain quality data. So I'm going to pass it back to Lisa to talk a little bit about what makes an HRIF project strong.
Thank you. All right, so what makes a really solid project that we're looking for? The first thing that we look for in HRIF projects is a very clear aim. So I don't know if you can see what this image says, but the person on the left is saying, our process is extremely efficient, and the person on the right saying, yes, but you're not actually going anywhere. So you might say, we have a new program in our community that helps clients look for private market rentals, and all the clients, 99% of clients are saying, this process is really efficient. It's really easy for me to navigate, which is great. But if that's not actually resulting in move-ins in your community, if that's not actually resulting in, those folks using those private market rental units, then you don't necessarily have that light at the end of the tunnel, that vision that you're really working towards. So having a really clear aim related to prevention or moving in folks to housing is really important as part of an HRIF project. A strong aim should be SMART, which is an acronym for, it should be very specific. So, is there a target population of homelessness that you're aiming to support through your project? It should be measurable. So again, you should have links to your quality data to be able to say, is homelessness decreasing or reducing month over month? It should be actionable, which means it shouldn't be too lofty that you can't attain this until 2035. Meanwhile, your project is only a year long. And it should be time-bound as well. So you should have a clear end date for your project. When do you want to reach this aim? And a strong aim should also be connected or part of your web of work. If this project, if a particular improvement project or HRIF project feels like it's something separate from your desk, that's not the best thing, because we want improvement or changes that you're making to help you in your day-to-day work, to make your processes more efficient and ultimately help you work towards that aim. And so, if you often have folks that are calling you to respond to encampments in your community, maybe you could focus a project on encampments. They should also relate or more primarily advance existing community plans or priorities. So if you have a local councillor or local mayor who says, we want to end youth homelessness or reduce unsheltered homelessness, your project should connect into that larger goal so we can understand how it contributes to the larger puzzle. And your aim shouldn't necessarily be a huge surprise to other local interest holders or community leaders. It should be something that your community feels strongly about. The target populations for HRIF are very broad, although we are prioritizing projects that focus on unsheltered homelessness. However, projects can focus on chronic long-term homelessness, veteran homelessness, or other specific populations under all homelessness, like single adults, youth, families, and Indigenous populations. So it can be, you have a very broad range to select from, but it is important to identify a specific population that you're hoping to reduce homelessness for. Projects should also have strong partnerships, both in the design and the execution of the project. So again, the eligible organizations for HRIF are community entities. And so local organizations should collaborate with community entities on this project. Consider how to partner with organizations that have specific expertise or mandates to support that specific target population. And collaborating with Indigenous-led organizations for either learning or unlearning is really important at all phases of the project, because we all know Indigenous homelessness is unfortunately overrepresented in virtually every community. And strong partnerships should really center the client who you're trying to support with through the project. Also, a clear plan for measurement or how you're going to know if the project is working towards your aim is key, but really that just means being able to answer these questions. What data do we need to look at? Who can collect that data? Do we have access to it? How often will we gather around that data and understand together if we need to pivot or change anything in our journey to reductions? There's 3 different types of measures that we can support communities with identifying, so you wouldn't necessarily need to identify these on your own. HRIF is an initiative from CAEH that we really want to support communities with. So as Alice said in the beginning, we are here to chat with you about any project ideas that you have and can support you to develop those. But really, projects should have outcome measures, which is your standard, what do we want to achieve? It's your desired result. Process measures, which more focuses on, are we doing the thing we said we were going to do? And balancing measures, which is about if changes that you've made in one part of the system cause problems elsewhere. And a strong change is, again, new. It's not just more of the same. So HRIF isn't about funding existing programs to just extend something that you know is working well, because that won't take you, because it hasn't taken you to the next level of reducing homelessness. So we want to see something that is new for your community, something that you're changing or testing a hypothesis of how can I try something a little bit different in my system of care. So it should also be like a question that you hope to answer. I believe that if we contacted more landlords or had a landlord liaison position, this would help us identify more units to support our clients, right? What's your hypothesis? What do you think is going to work? And then put that to the test. And yeah, a strong change takes context into consideration. So if, for example, you've been talking a lot about how health isn't on board, or you really want to engage your local hospital, then it might be wise to do a project that specifically focuses on the intersection between health and homelessness. So take context into consideration so this, again, doesn't feel like something additional on your desk and is instead helping you advance current priorities. And last but not least, a strong change helps to identify systemic inequities or potential solutions. So what groups are routinely impacted differently is a big question that we'd ask throughout the HRIF process, and one that we challenge you to think about during your projects as well. And before I turn it over to Kat, overall, a strong HRIF project is really dependent on that system level data, that inflow and outflow slide that you saw, because it's about having measurable reductions in homelessness. And really, we can't solve a problem that we can't see. We won't know if we were reducing and ending homelessness if we didn't look back to see the impact of our efforts. So I'll pass it back to you.
All right, so now we'll get into the fun part, at least for the data nerds like myself, so I hope I'm not alone in that. And that is how your system level data, thanks Lisa, can help you to identify and shape reduction projects. So as Lisa said, a strong aim is based on your inflow and outflow data and what it will take to reach your reduction goals. So this graphic on the screen here is a screenshot of one of the tools that is available to communities that work with Built for Zero and or Reaching Home participating communities. And this information can help communities start to identify where their change effort will be most impactful. So we're going to use this data. This is a fictional community, but we're going to use this over the next part of this presentation to walk through how a community might take their data. Like, this is not a real community's data, but every community working with us has a tool that looks exactly like this. So this is how we would be coaching communities to use this to apply to their local context. So first things first, what we see when we look at this high level of inflow and outflow are the positive things. We see that move-ins account for most system outflow, so that's good. That means that people are not exiting our system to never be heard from again. They're not falling through the cracks, that more often than not, they're moving into housing. And we also see that most people remain housed. Return from housing is very low, so we know that as this system, when they get someone housed, they can, with a reasonable degree of certainty, expect that that person will stay housed. But on the flip side, we see a couple pressures in the system. One is that people are aging into chronicity before they can secure housing. And the second is that there's a steady inflow of new homelessness entering the system. And this is important to look at this holistic view of a system, because even in a community like this where move-ins are really high, that doesn't necessarily mean homelessness will decrease if the inflow pressures are greater than the folks that are exiting into move-ins. So this is at the highest level how we can start to look at where we might want to inform our efforts, but this isn't enough. Strong projects do not stop at the presence of a high inflow or outflow value. They dig into the root cause. So to use a really simple analogy, consider having a headache and then taking some Advil for your headache. This will probably address the symptom, but it doesn't address the issue that's causing the headache in the first place. So if what is giving you a headache is that you're not getting enough sleep at night, you can take all of the Advil in the world, but you're going to continue getting a headache until you start getting more sleep. So obviously that's very simplified, but again, looking at we can't just treat the symptom in the program and expect systemic change to take root. So the intervention or change that your project is testing should get to a level that's deeper than just the inflow or outflow data point. But the data point can tell you where to start looking. It often doesn't provide enough context, but it can tell you where you need to dig deeper. So you don't need to dig into absolutely everything going on in your system. You can just start with that first flag. So we have a couple examples here of what you might ask to dig deeper. First being low move-ins. So we see this a lot. A lot of communities really struggle to find opportunities to move folks into housing. But the questions we would ask would be, what are the specific barriers to getting people housed? Or is housing stock low in your community? And I think everyone's gut reaction to that would probably be yes. But is this true? Like, can we actually determine that this is the cause? It might be the cause, and it also might not be related to the issue that you're seeing. Like, both things can be true. You can have a limited supply of housing and have that not be the biggest barrier that's happening in your system. Other things to look into are, is this a problem across the board, or is it related to one service provider, one population? So are we seeing move-ins that are disproportionately low among youth? Are we seeing move-ins that are really high among one of your providers? Is there something we can learn from there? On the other side, we can look at high rates of newly identified. So some questions that we might ask to dig into this data point is, what are the pathways by which people are becoming homeless? So are they new to us? Have we interacted with them in the system before? Are they local? Are they coming from somewhere else? Are they coming, again, from common sectors or common service providers? So still not there, but we're getting closer. And the reason that we need to dig deeper here is to avoid investing our time and energy into resources that aren't going to be relevant for our context. So going back to what Lisa was saying about, you hear a really great example of a program that's having success in another community, you want to run home and implement it, but that might not work for you if you don't have the same problem that they do, and you probably don't, because every community is very complex and very nuanced. So it's worth just taking a little bit of a step back to really understand, is the success that they had there something I can replicate here? So one of the ways we do that is with problem statements. Developing a problem statement can help to clearly identify the nature and scope of the problem that you're trying to solve. And it's a really simple exercise that we probably all learned back in elementary school of the who, what, when, where, why. So what is the actual problem? Why is it a problem? And you're going to see in a couple slides what I mean by this. Where do you observe it happening? Who is being impacted by it? How long has it been going on? And also, what are the impacts on different populations? So how is it impacting the people we're serving? How is it impacting our staff? So really understanding the full scope of the problem. Once you have obtained a clear understanding of the issue and identified an intervention that you want to test, you'll want to calculate the impact of your intervention and that it will be enough to make a difference in your community. So again, we have all of this data. We're not collecting it just for fun. We're collecting it so that we can make data-driven decisions that will result in lasting change. So what we want to avoid is saying, we're going to hire a landlord liaison worker and house 20 people. Well, what does that actually mean? So this is a newly built tool that we have available to communities that we work with that helps to see the impact of a particular intervention. So this is a planning tool, and I'll just walk you through kind of quickly what it includes. So at the top, we can filter the data by whatever data the community is submitting. So in this case, we're looking at total chronic and move-ins. So we're going to walk through an exercise of planning what a potential move-in project would look like. But if you have additional subpopulation data, you can slice the data to be whatever is meaningful for your community. On the left-hand side, we have a little bit of what is the status quo. So how current is this data? What is the latest active homeless for that population? And what is the average data point that we've selected? So in this case, the data point is move-ins. The average is about 92 per month. So this would be, a large community. And that tells you the status quo. You need to know where you're starting so that you know what an improvement is. Similarly, looking at the status quo, this little bit in the middle here is showing us what is projected to happen if everything continues on as it has been for the last month. So this uses the last 12 months of quality data, and it updates in real time as new data comes in, and tells you what is projected to happen at the end of your project duration. So the default here, what we're looking at is 12 months. And what this says is that in this fictional community, if everything happens exactly as it has happened for the last 12 months, we can expect that homelessness will go from 1,785 to 1,376 by the end of the 12-month period, or will decrease by about 23%. So that's great. What this tells us is this community is actually decreasing homelessness already via status quo. So they would be looking at a project that would accelerate that. We're going the wrong way. So to use this planning tool, we first want to select the desired percent change from baseline. And sometimes we know that and sometimes we don't. So you might say, in this example, we want to increase move-ins by 5%, or you might say we want to increase move-ins by 65. So you can use the slider either way, whichever one makes more sense for you to start with. And that will then tell you what is going to be the impact on your system if you're successful in achieving that aim. So in this case, if this community is able to house an additional 65 people as a result of this intervention, they can expect that homelessness will decrease by 27% instead of 23%. This is not an exact science. This is using historical data, and sometimes things change. Sometimes what was true last year is not true next year. But what we do know is that it's the best we have. So the past is the best predictor we have of the future in the absence of being able to, look into the future with our crystal ball. So it gives us a more informed projection. When you are finally happy with the number that you've selected, so whether this is the number of people you reasonably think that you can help with the intervention you've planned, or it's the percent change that feels good to your community that you want to achieve, it will then tell you what this means on a monthly basis. So in this community, we see that the average move-ins is about 92. In order to achieve this reduction of 65 people over the course of 12 months, we know that we would need to have a monthly move-in rate of about 97, which is a difference of 5 people. So it allows you to break it down. And sometimes I think that when we're setting these ambitious goals, it sounds really great to say, we're going to have 65 people. But when we actually do the math, it's like, what are we talking, though, in terms of numbers? Because sometimes the numbers don't quite work out how we expected. If our aim says we need to house an additional 150 people a month, probably not attainable. So it just helps you see, put it in context and put it in real terms of what you're actually going to need to do month after month in order to realize that aim. And then finally, when you're happy with that, it spits out a nice concrete aim statement for you. So not only does it tell you what the overall impact will be on homelessness overall, it also tells you what the impact will be on that particular data point. So 2 credible ways to measure your change, depending on what is most meaningful for your community. And that is the tool in a nutshell. So to put all of that into reality, we're going to walk through an actual example. So we have another fictional community. We're going to call it Lily Cove, and we have tried to keep this example very straightforward, hopefully pretty relatable right now given our current context, but also just keeping it simple so you can really understand how you would apply this locally. So Lily Cove is experiencing higher than usual rates of unsheltered homelessness. City Council is very keen to find solutions to those encampments, and there's 2 service providers in the community that are doing basically all of the homelessness response work, including providing services to those that are living unsheltered. So if that's kind of all of the information we have to go on, again, we know that's not enough. So if there are any parents in the room, I will ask you to just humor me for a moment and channel your inner toddler. Because to get to the root of the problem, what we want to do, or one way that we can get there, is to repeatedly ask why. And keep asking why until you can't ask it anymore, and then you're probably pretty close to the root of the problem. So in this case, and again, thinking of the inflow, outflow data that we had earlier, we know that unsheltered folks are not moving in at a rate that is similar to others. If we ask why, we might find that people experiencing unsheltered homelessness are not being referred to available housing resources. So it's not that no one's moving in the system. As we mentioned on the earlier slide, that it's disproportionately low for this group. So there are pathways into housing, but it's just folks that are living rough are not able to access those pathways. Dig into that a little bit deeper, and we find out they're not reaching the top of the priority list. So when a housing resource becomes available, we're not making those offers to people who are unsheltered. Dig in a little bit deeper, and this might require talking to the frontline service providers, and we find out that clients are missing appointments with their housing workers. And when we dig deeper into that, we find out it's because the housing workers don't work mobile. They are office-based only. They work 9 to 5, Monday to Friday, and they don't have the ability to leave the office and meet clients where they're at. So that means clients are missing appointments. We don't have complete information, so we're not able to make informed referrals, and thus they don't reach the top of the priority list. And we just keep following it, and that seems to be why people are not getting referred to housing in this community. So suddenly we see that the issue is much more complex than we thought. What we started with was folks who are unsheltered are not moving in, and unsheltered homelessness is high. That could be any number of reasons, but when we go through this exercise, we have a pretty good hunch, and a hunch that is actually informed by some evidence from looking at the data and speaking to folks in the community. So once we have all of that, we can then develop the problem statement. So going back to that who, what, when, where, why, and making sure that you can reasonably answer most of those questions. If you can't, you haven't dug deep enough. But in this case, we have a pretty good sense. Because existing case management services are limited to 9 to 5 in the office, people experiencing unsheltered homelessness are not being prioritized for available services because information to support housing referrals is incomplete. And why is this a problem? Because as a result, move-ins for this population are low and unsheltered homelessness is increasing. And that why is this a problem is really important. It seems like the most obvious one, but being able to articulate why this thing needs change, why this needs your investment, is part of how you will get people bought into helping execute this change. So to then take this forward into what an HRIF application or an improvement project would look like, we might now say that because we know the issue is that there are no mobile outreach services, let's try that. And we're not going to try it with a whole team of 10 people and buy 3 vans. We're going to hire 2 outreach workers, and they're going to work in the times that we've identified where there is a gap in the system. So 2 folks who are going to work evenings and weekends, and we are going to test that hunch and see if it works. We then work to set what feels like a meaningful aim. So going back to the aim tool again, which I'll show you in just a moment. And thinking about how many folks can 2 workers reasonably house. So again, this is fictional to just walk through, but if we say, 65 between the 2 of them over the course of the year, that feels attainable. The measures, so the way in which we will make sure that this project is accomplishing what we want it to. The outcome measure is just plain and simple, what are we trying to accomplish? We're trying to increase move-ins. So the outcome measure is the number of move-ins. The process measure is how we make sure that we are actually following the change idea that we implemented. So we can't run the whole project and at the end of the year say, oh, well, it didn't work, and then find out it's because we actually didn't hire both of the people. So the process measures test whether you actually ran the change idea as you intended to. So in this case, the number of referrals that are completed, because that's what we're asking them to do, and the number of engagements they're having with folks experiencing unsheltered homelessness. And the balancing measure, again, as Lisa mentioned earlier, is just keeping an eye on something else, like another problem that you might inadvertently cause by putting all of your attention on this area of your system. So for example, in a project like this, we might want to make sure that we're taking a look at move-ins for other populations and that we are still able to house everyone else now that we suddenly are going to expect a big influx of unsheltered folks on the priority list. So do we still have enough housing resources to go around now that we have the full scope of people on that list? So to just return to this cool tool that I hope you all love as much as I do, we can now see the expected impact on this project. So I've put in the same numbers that we've just been talking about. And if this community achieves its aim of 65 additional move-ins, they can expect that homelessness will decrease by 26.6%. And they know that in order to achieve that and see each month if they're on track, they need to have a total move-ins of about 97. So that is the very high-level, quick, what an improvement project might look like, starting from data dive to application. And I'm now going to pass it back to Alice to facilitate some discussion questions.
And thank you, Kat and Lisa, for that. We're now going to go into a very exciting part of this conversation. We're going to be talking both ways right now, and we have some discussion questions up here and want to invite folks who would like to respond to any one of these questions up here to just signal. If you also have a question outside of this question as well, you're very welcome to ask those questions. So just want to pass it on to you folks to ask the questions and just have a conversation. Thank you.
Hi. So I work, I'm with social development in northern New Brunswick as a homelessness strategist. We have a particular kind of scenario where we're really short on nonprofits. So a lot of people around our cap table are government representatives of different branches of government. And all of the people at the table have very limited time to kind of put into applications for grants and so on and so forth. And being here at the conference, I hear that there are lots of funding opportunities, but we're not tapping into because we don't necessarily have a dedicated resource for that. And since we have very few nonprofits at the table, it's not as easy as saying, oh, we'll add a resource with them and then maybe they can, but I wonder if have there ever been projects that center around hiring essentially a person to apply for grants and kind of do that legwork to, because it seems like that's where we hit a bottleneck. Our municipalities are strapped for cash with some recent changes in agglomerations, and they're short on funds to put forward. I mean, we do access SD funding and Reaching Home funding, but at the end of the day, we're the one thing kind of preventing us from building more services is accessing more funds, yet we don't have the manpower to go around and apply for the grants that are out there. So is there a link there, or I guess, I'm not sure if there was a question there. But
Yeah, thanks for the question. I think that without having more context than that, I would say that HRIF is probably not the suitable fund for that. And the reason being is that one of the key objectives of HRIF is to achieve measurable reductions in homelessness within the scope of the project. So to hire a grant writer to then apply for grants to then hopefully get the money and then be able to execute the project, the potential for reduction would be too far away. But I wonder if Lisa has additional suggestions as well. Where I initially go with that is the folks who would have more vested interest in completing the grant application would likely be the ones that would want to deliver the program. So we have seen other communities do that, where the CE, for example, needs to be the one to actually submit the application, but the service provider who's going to deliver the work can kind of do the legwork and partner with them.
Is this on? Yeah. And I also want to add, this is a little bit of a unique funding opportunity because improvement advisors with CAEH are dedicated to supporting the applicants through the application process. So, we can support you answering the questions in the application process, help to develop that project idea, help you to become eligible by supporting your community to get to quality data if you aren't yet confirmed for that. So it's a very hands-on process whereby we would work with you to help develop that project so that we have strong applications, because our goals are the same as our applicants. We want to reduce homelessness and spread those learnings across the country. So it's a really supportive funding process whereby you're not just going to submit an application and not have no idea if it's relevant or eligible. We first have an expression of interest process that will open again in February. And that's really just to shoot some ideas out there so we understand who's interested in the fund, and then we will connect with you to help develop your application to then submit within a month and a half from that time. So it is a very supportive process, and we are able to help you apply for HRIF. With that being said, I would just repeat or echo what Kat said about you do need somebody to actually run the particular project. It could be like hiring a staff person if you believe and your data is showing you that is a change that's going to lead to reductions in homelessness, as opposed to just capacity building to apply for other funding opportunities. Because again, the goal for HRIF is to reduce homelessness for target populations.
Hi, my name is Emily. I work for Covenant House Toronto, which is the largest youth shelter in Canada. And we know that of all people known to be experiencing homelessness in Canada, about between 44 and 50% of them had their first experience before the age of 25. We're seeing this more in retrospective data because so many youth are experiencing hidden homelessness and couch surfing. And what we see in Toronto is the need for more shelter diversion, because our shelters are so overwhelmed, and a lot of times when youth end up entering the shelter system, it's not a great place for anyone to be in. I say this to someone who works for a shelter, but we do our best. But we know we need to amp up our shelter diversion work, and we've had a bunch of really great conversations across the youth sector in Toronto about the need to have diversion as part of an intake process, not just we'll refer you to this diversion program. And we're working across organizations and seeing, could we get this funded? How does this look with family and natural supports? But the one, I guess, I'd love to hear your take on, we know this is needed, but would this make a good project for this, given the number of youth that are trying to access the shelter system and already turned away? And I don't know if they're showing up on by name lists, so I'm not sure if we'll see that reduction in the numbers. I mean, we very well could. I don't know. Do you have any take on that, if this would be a good kind of project for that?
Can I go? Yeah, short answer, yes. Long answer is one of the first steps that we would take would be to hear about what is the actual idea? How many people do you think that you could divert? And we could use that tool with Toronto to see would that be enough of an impact? And that can sometimes help us understand, are there gaps in the data? Is it complete? Because oftentimes, we don't want to make decisions based on our gut when we have data, but sometimes your gut will tell you if the data is incomplete. So that would be part of like kind of the hands-on intensive process that Lisa was talking about, where if it turned out that we actually don't know that we have all of the data we need to measure this effectively, then maybe that's step one, and we would support you with that first and then apply in a later round. So I would say it's definitely worth engaging with the idea and like working with your CE on a project, because our staff are available to support in that development.
Yeah, you could even ask the CE or partner, just do it internally for 2 weeks. You decide to track any gaps in data that you think you might have related to diversion. So for example, like a common place to start is if youth are being diverted from, like if you're counting like, oh, I found an alternative place, a safe alternative place for them to stay. They did not enter shelter. You could chat with other shelters in the area and see, did they go to another shelter? Do I have that data available? And the CE would be your best bet to figure out what data is available system-wide so that you can understand how youth are interacting with not just your particular shelter, but other homelessness services, and then identify where there's some gaps, but we could support you to set up like a little bit of a initial test to gather some more data of like, what you might be missing to then design the improvement project. So it is applicable.
And that test happens after you have access to the funding or as part
It's-
of the application process?
It would be advisable to do that as part of the process so that we can design a project that really make sure that you're having like a solid change, a solid hypothesis to reduce youth homelessness or to increase shelter diversion. But it could be part of it. Just kind of depends what we would get back from what data you already have. So it would require us to chat with the CE, and we can chat after as well and set up a conversation. Yeah.
Hi there, my name is Daphne Sinclair and I work for the Assembly of Manitoba Chiefs in Winnipeg, Manitoba. We represent 63 First Nations on and off reserve, and there in Winnipeg alone, there's a very high population of First Nation homelessness, and we're seeing, and we still have a very high rate of kids in care, and so we have a very kids, so there's a very real issue of the youth aging out of care. So we're seeing kids being dropped off at homeless shelters as soon as they turn 18. It's not a good path from the day you're dropped off and trying to figure out what to do and so forth. So we recently, just probably last week, purchased a building specifically for youth aging out of care, and an apartment building. So I'm probably gonna give you my cards because I would like to have somebody from your team maybe have a Zoom meeting with us, me and my team. And so we have within our organization First Nations Family Advocate and Eagle Urban Transition Center. So those are two service provider entities, and we're trying to work together as a team on trying to tackle some of these issues, what the barriers are and so forth, and we're just kind of getting inundated right now with so much that's on our plate, and I'm kind of just like vibrating a little bit because I feel like there's just so much that I feel like, I got to remind myself, Rome wasn't built in a day. So I kind of want to work with you guys because we need that data. We don't have a data team at all. So we definitely need to start finding the thread in this big ball of twine, like these thread entrances, and work from there. So I definitely would like to reach out to you guys and work with us on something. Thank you.
Yeah, absolutely. Yeah, that would be great. And also, that's a lot. Like, can we give you a round of applause to just boost you up? Like, you're dealing with a lot for sure. We'd absolutely love to help and have a further conversation. But yeah, that sounds intense. Yeah.
Thank you.
Thanks for still coming to the conference.
At the back, someone? Okay.
Two-parter. I'm thinking about a change idea that's around screening for acquired brain injuries at triage or during a case management meeting, for instance. My hypothesis briefly is that some people aren't ready for case management or housing first interventions briefly because, well, if you have executive dysfunction or memory impairments, it's hard to engage in certain things. Would that be an okay project? And if so, how would you recommend moving forward in a unionized environment, for instance, where change management might be a consideration? Yes.
Yeah, I can start. So I think in terms of would that be an appropriate intervention, I would encourage you to kind of walk through the whole problem statement process to articulate, first of all, why is this a problem? Like, is it that people are being referred to services that like they're not able to meaningfully engage with? Is it that they're not getting referred? So like really drilling down a little bit more. I think what would need some further development is what's the solution? So the screening is a great first step to understand, is this a problem? But then how are we solving that problem if it is there? So maybe, again, I think as with everyone's ideas, like with this much context, it's hard, but it sounds like there could be something there. The unionized one is a great question. My first thought is, can you do like a temporary kind of reassignment? So sometimes we look at folks to say, even before, we get to an HRIF improvement project level where there's even funding attached, to saying, hey, like we have a theory, does someone want to just try doing something a little bit different for 2 weeks? And if it's something like screening in a process that you're already doing, it's not necessarily outside of someone's job description, to just say, can you use intake form B instead of A? To start to build a use case for why you actually might need a position to make it more formal. But I'm happy to chat like further afterward about some other strategies. It's a great question.
Hi, I'm a CE, and the first time I've heard of HRIF was an email from a project that I got saying they applied for it, they were denied. What happened? And that was the first time as a CE who learned about this project. So my question is what I'm seeing here is that communities that have data entries can apply for this. But if you're in Manitoba, there is only 2 cities that do data entry. The rest were trying or wanting to get in so they can get extra help. So how do we do that to get our smaller communities into a data entry so they can apply for this? And where can I learn more about this so I can inform my project so I have an understanding?
Yeah, absolutely. Like we would love to meet with you to chat more about, your local context, how we can support, because again, like we are here to support communities through the EOI and the application process. I'm not surprised if you haven't heard of HRIF before. It is new. Like we're just in the middle of applications for the second round, so it just opened earlier this year. So it is a fairly new initiative, but I'd love to chat with you further about what are some things that we could try or do, so that you could see a project in a particular smaller community that might not be entering data or participate in that process.
We have one more in front here. Thank you.
Thank you. What is the average amount of funding that a project would get? And did you say it was for 1 year, the project? So are you looking at things that kind of could be self-sufficient afterwards that are, okay, and sorry, just about the average then?
Yeah, I don't have like an exact figure from our first round. We haven't done like official announcements of our round 1 communities. We're doing that in partnership with our funders, the federal government, but we should be announcing those tomorrow, I believe, during the conference, which is great. But I don't have an exact number, but usually they're asking for around like anywhere between 200 to 600,000. It just kind of depends on what it is that that you're doing. So sometimes that's like staff positions, sometimes that is like a little bit of community engagement funds to support, sometimes that's training to support some capacity building. It can be a whole range of things. And so, yeah, we've definitely seen amounts smaller than that and amounts higher than that. So there is no limit per se, but we will, try to support you to scale your project to what's reasonable within a year timeframe. And yes, it does need to be sustainable post that 1 year, because we're not looking to fund ongoing programs. We're looking to fund projects that then you could build a use case for to build that sustainable funding afterwards. So in the application process, we do ask and support you to figure out, like, if this was successful, like, how are you going to get, like, where do you think you'd go in order to get funding to support this at the end of the year? Because, yeah, this runs for 5 years. It will end in 2028. We can fund the same community or service area more than once in different rounds, but we would be looking for different projects or scaling up or like learning more and doing something different on a top of what you've already learned in the first year, if that makes sense. So we wouldn't be funding the same project, in more than one round. We'd be looking for something that, is sustainable beyond that year, and we'd look to fund something different.
Thank you, folks. Do we have any more questions in the house? One more. Thank you.
Maddie from Whitehorse, great presentation. I don't know if I'm going to articulate this very well, but one of the things that we're working on in Whitehorse is I work for the CE, is our relationship with the major shelter provider who doesn't receive Reaching Home funding. And they just signed a new agreement with the territorial government around increasing the number of outreach workers in the shelter with the idea that the shelter will be more housing focused. I think there's some skepticism. I haven't seen this agreement, so I don't know exactly what it looks like, but a bit of worry that they might not have the actual resources to train their staff to be able to do the housing focused work. And I think my question is, like, in an environment where there is a lot of change already happening, or there has been a major change, and we might not have a good baseline around, like, the number of move-ins that are happening out of shelter, can we add in another change where we're funding training for shelter workers? Is that like a viable project?
I think it would depend, and happy to chat further. I think what we are not looking to fund through HRIF is just filling gaps that should be funded elsewhere. So, for example, like an existing program that's funding is ending, and they're just trying to keep that sustainability piece going. So in what you just described, it sounds like there is like more of just a gap in business as usual rather than a change. However, there is also plenty of opportunity for communities to leverage things that are already happening. So I think that you could approach it that way to say, okay, like, what is this trying to accomplish and how could we accelerate that and what would it take? So not a clear no, but let's chat further.
Great, thanks, Kat. I see no further hands raised, and I think that concludes the Q&A session. Thank you so much, folks. In the same room at 3:45 p.m., there'll be a session where we'll have some HRIF-funded communities sharing preliminary learnings and things that they probably have learned from just getting started. So if you'd like to be a part of that conversation, be here at 3:45. And we'll move on to Ask the Expert, and that would kind of conclude this session, but after this, you can definitely meet with Kat or Lisa to build your ideas even more and chat one-on-one with them. They'll be right here to connect with you. So thank you very much for your time. We appreciate you. Thank you.